Hello, good evening. I'm Dr. Shakti, and we're going to wrap up with general physiology with today's lecture. So far we covered your cell membrane, its properties, and in the next class we dealt with the various organelles that are involved in the cell, what are their functions. Now we're coming to a very important topic, that is transport across the membrane, because this is important because the entire physiology is based on this. What happens is students do not study this chapter well enough, just briefly leaf through it, and later on when you come to your um, renal system, for example, or your GIT for in terms of absorption, they find a lot of difficulty in understanding certain concepts because they do not learn this topic well. And apart from that, if you look at it in terms of the questions that are being asked from general physiology, most questions are coming from this particular topic, that is transport. This can even come as a long question, even 10 mark a long question regarding the entire transport mechanism. It can come as a 5 mark question, also the same question, in which case we have to, you know, um, give it in point form, little more, less detailed. And of course, we have the question of your sodium potassium ATPase, which is often repeated. So, under that, what do we have to write? How do you go about this topic in a proper fashion? Because one thing I realized in different textbooks, it's all given a little different in different ways. So at your level to read textbooks and completely understand this in a way you can put pen to paper is going to be a little difficult. Okay, so that's why I'm here to help you out with this topic. And again, this is a very important topic. Right. So let's start off with the topic per se, that is transport. So when we talk about transport, um, we are going to talk about the transport across membrane. So what are the particles that can cross the membrane? Some sort of solute, solvent, water. Okay. Using concepts that you learn in this heading, later you can understand something which is transcytosis and your paracellular. So all of this requires various things that you learn under this heading. Okay, so to begin with, we understand that your cell membrane is bilayer phospholipid system, which has a phosphate group on either side like this, and we have lipid bilayer on the inner leaflet area. Okay, so if you look at a membrane, the center part of the membrane is going to be lipophilic or hydrophobic. Okay, now if you look at a substance, for example, steroid. Okay, so you're giving a drug, for example, steroid from outside. Cell has to take it. Now, how does it go through and reach inside? Because steroids are, derivatives of cholesterol, it is able, because it is lipophilic, it is able to cross directly through. Other substances which are non-ionic in nature, for example, your CO2, oxygen, all of these again can pass through the membrane without need of anything. On the other hand, certain substances which are polar, let's take an example of sodium ion. So for it to pass through, there is no way it can pass through, even if it passes through the top part, since it is not lipophilic, it is hydrophilic, it cannot pass through. So that is where we need a separate set of transporter or channel, pore, any of those things to transport these polar substances. Okay, so this is regarding the solute. Now, in terms of larger particles, there are various mechanisms where the entire membrane can bud inside and form certain vesicular, that is what we call vesicular transport. There's different ways of endocytosis, pinocytosis, different terms you'll come across. Okay, so this is what we're going to understand today. So we're going to start off with your initial transport across membrane. Under transport across membrane, the first is passive. Passive transport. So across membrane, there can either be passive or active transport. Passive transport means from an area of high concentration, it is moving to an area of low concentration. How is this possible? You take an area like this. Basically, all of these have their own kinetic energy. They'll keep moving here and there, bombard against each other to a degree. That will result in the Brownian movement. So when the concentration is much more higher in a known volume, okay, compared to the other side, which is much more lesser, there is higher probability for more of these particles to move this direction than it moves this direction. So it's not like it's not moving in the other direction, but higher probability of things to move in the down the concentration gradient. Okay, so this is basically your passive transport down the concentration gradient. This is of three types that we're going to discuss today. One is simple diffusion. Second is facilitated diffusion. And third is non-ionic diffusion. So this is something students often do not write in answer papers. So we have simple diffusion, facilitated diffusion, and a third one, which is non-ionic diffusion. So in simple diffusion, what is it? You open up a channel. Okay, this channel, whatever is opened up, and it moves across it. It does not even require a channel, like the lipase we were talking about. So it can either go through the membrane through lipophilic substances like steroid, CO2, O2. So this is various ways by which lipophilic substances can go through simple diffusion. Another thing is there can be certain pores. So pores are ungated. While another concept is channel, which are basically gated in nature. I'm just going to give an example. The pore, for example, one example that you can think of is a porin, perforin, and although the name is a little contradictory, aquaporin channel. We usually tend to say it as a water channel, aquaporin channel, but in fact, it is a pore. It is ungated pore. On the other hand, almost all ion channels, they are channels. Okay, so when you write this answer, sometimes I've seen questions come for the university where they're like, describe the different types of transport mechanisms with examples for each. We need to know examples for each of them. That is why I'm specifically mentioning this to you. Okay, so in simple diffusion, we have again a membrane, and from a higher concentration, it goes to a lower concentration, either through the membrane, through a pore, or through a channel which is having a gate. Okay. This gate that we're talking about, that gating system can be opened up by either a ligand, so they can be ligand gated, or membrane voltage, or some sort of phosphorylation. It can be mechanical in nature, or even some sort of chemical or enzyme. So different forms of gating is there. So for one example, from outside, there is a particular ligand which is coming. Okay, acetylcholine, for example, it comes in, binds to this, and because of that, it opens up. Membrane voltage. One example for membrane voltage is during action potential. Once your resting membrane potential goes and reaches around minus 45 degree for 45 millivolt, what you have to understand is that is going to open up a whole lot of different channels called voltage gated sodium channels. That is what results in action potential. Phosphorylation gated channels are there. For example, how your insulin is acting. Mechanical gated, for example, how pressure by touch and all that, how you're sensing it through the receptor is because of such mechanically gated. Okay, or they can be some sort of chemicals also which can be involved. So these are different things that you can talk about under simple diffusion with examples. Okay, facilitated diffusion, on the other hand, if you were to look at a membrane, there's going to be a carrier protein. This is going to come and bind to the carrier protein, upon which there is going to be a configurational change to this. And it'll put things in. This is still going to be down your concentration gradient. Facilitated diffusion. Okay. On the other hand, when you talk about non-ionic diffusion, in non-ionic diffusion, basically the membrane which is there like this, imagine something like H plus, HCO3 minus. This is polar in nature. It cannot pass through the membrane unless there is some specific kind of transporter. So H plus HCO3 minus is going to get converted to H2CO3, which is going to split to form your water and CO2. This CO2 is going to go inside the cell and it is going to combine with water. Okay, it will go combine with the water to give back your H2CO3, and which now splits into H plus and HCO3 minus. So what happened? It's as if this
Oxide enters the blood. It combines with water to form carbonic acid, which dissociates into.
Sorry for that. So what happens is your ionic component, the polar component like H plus, that gets converted into a non-ionic component. Then it gets transported across and then goes back to the ionic form. Okay, so indirectly a non-ionic diffusion took place. So I was talking about facilitated diffusion earlier. Okay, so now at least you understand the difference between simple diffusion, facilitated, non-ionic diffusion. We'll go more into detail with your facilitated diffusion. So in facilitated diffusion, there was a carrier protein which is there. Okay, if you look at the simple diffusion versus facilitated, what is the difference? Does the channel pour over your simple diffusion and facilitated diffusion as a carrier? So what exactly is the difference in this? So in order to understand that, you can take a look at this. So this is how it's basically, gonna act. Okay. So over here, there'll be a binding area. This is one side of the membrane. The other one is the other side of the membrane. So certain component, any sort of a ligand which is moving in, it goes in, attaches to this binding site. Okay. The thing about these carriers is it has two different states. In one state, it is open on one side, closed on the other side. On the other state, it is open on the opposite side and closed on this side. And these two states can never coexist. Okay, so now what is happening? It is in one state, it goes inside, goes to the binding site. Then immediately after that, what is going to happen is it gets shut off on either side. And it is still attached to that binding site in the center. Now, after that, what is going to happen? It is going to be pretty obvious what is going to happen next. The opposite side is now going to open up, resulting in this moving out of the binding site. So two things you have to remember, it has two states. And these two states never coexist at the same time. And at the center, usually there is a binding site. And if at all, two different forms can coexist, that is basically two shut ways, never two open on the either side. Okay, so this is an example of a facilitated diffusion, how a carrier protein works. Now, coming to an example, most common example that you can come across is what is called a GLUT. These are basically glucose transporters. Now you have to understand, apart from this, glucose can be transported in other ways, which will come across later, secondary active and all. Okay, but this is one of the most common ways by which GLUT is transported. This is something you learn later when we talk about diabetes, insulin, and all that, and the importance of this transporter. So you have to remember, GLUT is generally, some of them are taking it through facilitated diffusion. There are, of course, some glues which, by normal kind of diffusion can also happen. But most of the GLUT are your facilitated diffusion. So around 14 different types of GLUTs are known so far. Apart from GLUT, we have urea transporters. UT, which you learn in renal system, important for concentration dilution of urine. So I'm again giving you examples because this is what gets asked in the question, either as MCQ, fill in the blanks, or as part of the question, they'll expect you to give examples for each. And what about non-ionic diffusion? I've already given you one example, that is your H2CO3. Apart from that, for your NH4 plus, it can, be transported through your NH3 form and get transported. Okay. Apart from that, some studies have shown some types of short chain fatty acids in the colon to be uh, traversing the membrane through some sort of non-ionic diffusion. So these are just some examples for non-ionic diffusion. So we've only done 1/3 of that long question so far. And we have so much data to write under this. And we still have not done with this. Okay, again, a separate short note can come here, where they'll ask you about simple diffusion and what are the factors affecting simple diffusion. And another question that can come is, what is the difference between a simple diffusion and facilitated diffusion? These are very often asked questions. Okay, so coming back to your simple diffusion. So any form of diffusion, actually, for that matter, if you look at it, if there is a membrane here, and through a small hole in that membrane, it is going from an area of high concentration to an area of low concentration. So how much is the concentration here? How much is the concentration here? Higher the concentration gradient, we'll call it delta C. Higher the concentration gradient, more will be the flow. That is one thing. Second thing is the area of this. If that pore is small, then only that much can go through it. Imagine you're in a classroom and suddenly you hear about a bomb blast somewhere, and that door is a small, narrow door. Even if everybody tries to move out, there's only a limit to which it can go through. But instead, if it was a larger door, more people can go out. Okay, so area is directly proportional to it. Okay, what about it has to traverse through the membrane? Okay, so it becomes difficult for that. Okay, so if the thickness increases, then your rate of flow decreases. So that rate of flow, we'll call it as J. This rate of flow, which is called flux per unit area. Okay, so the flux which is there, that is directly proportional to the concentration gradient. More the concentration gradient, more the flux. Area increases, more the flux. Okay, thickness increases, then less is the flux. This is what is called Fick's law. So this can come as a question. Explain Fick's law with the equation and explain it. Okay, now the other question, factors affecting your diffusion. You already have some factors. One is concentration gradient, another is area, the other one is thickness. Now to make this equal, if you have to remove this proportionality, make it equal, you can put a diffusion coefficient. Now, various things are determined based on this. For example, your temperature. Higher the temperature, more kinetic energy and more diffusion will happen. Okay, that is one thing. Your size, the charge of the particle. Okay, so like this, even apart from concentration gradient, sometimes you can replace it with pressure gradient or electrical gradient. In special types of movement across the membrane, which is called filtration, for example, this can be involved. Flow of ions and all, you can talk about electrical gradient. So usually electrochemical gradient, both are involved. We learn about this in nerve muscle physiology. Okay, so basically this is Fick's law. Okay, and what are the factors affecting this? All of these are various factors affecting this. Okay, so now you can write down that answer. Now the next question is difference between simple diffusion and facilitated diffusion. So simple diffusion does not need any carrier. Facilitated on the other hand requires a carrier. So what is the problem with that? So if you were to plot a graph with the concentration of the substance and the rate of flow. Usually when the concentration increases, what is going to happen? The rate of flow keeps increasing. But when we look at the facilitated diffusion, when the concentration increases, then it's actually a little more faster. So you can see it, going higher, but at some point it goes like this. Does not stop, but it goes to a maximum J max. That is the maximum speed it can attain. Okay. Why is that happening? Because of saturation kinetics. Because the carrier proteins that we're talking about are limited in number. Because of the limitation of the carrier protein, no matter how much concentration gradient is there, how much of concentration is there increasing, at some point when all the carrier proteins are saturated, you cannot go any more faster. Okay. So basically, this is the difference between your simple diffusion, facilitated diffusion. And you can give a third reason as an example. So we have three reasons now. Okay. So with that, we come to an end of your passive transport. Okay. Any of this can come separately as a question. So be prepared to answer that. Next is active transport. This is very important. So when we talk about active, unlike what we saw earlier, inactive, what is the thing? From an area of low concentration, it is moving to an area of high concentration, which means somebody has to push extra from this side. That extra is usually with the help of some sort of energy, for example, ATP. Okay, so each bond of ATP phosphate bond that you break, around 10 to 12 kilocalorie of energy is given from that. Okay, so energy from ATP, that is active transport. Now, active transport can be divided into two types. This is very important question. Okay, so one is primary active, the other one is secondary active. The primary active is the secondary activity. So in primary active, I'll first give you the example. Okay, so in primary active, what is going to happen is the energy is utilized by that same system. Whatever is transporting it, that itself utilizes the energy. That is primary active transport. In secondary, what is happening? This transporter is there, that does not utilize the energy. Something else utilizes the energy, and that indirectly results in whatever is happening. So I'll just give you an example for you to understand, all of this. So you're driving a car. Okay, I'm residing in Shillong right now. So a lot of hilly terrain which is there. So one thing I noticed, taxi drivers doing here, in order to save fuel, they put the gear on neutral when they're going down a cliff. Okay, so you keep driving, and when you reach a slope going down, you put the gear on neutral and just go down. Your vehicle is not utilizing any energy, it is just going down concentration gradient because of the gravity. That is an example of simple diffusion. Okay. On the other hand, before this, I was in Goa actually. So over there used to be, rivers, ferries, and all that was there. So what you do is, onto a boat, you take a vehicle, park it inside, and the boat will carry you with the car to the other side. You're not owning the engine, you're not utilizing energy in any way, but there is a boat which is acting as a carrier and taking you to the other side. This is an example of a facilitated diffusion. Now we'll come back to Shillong again. Now we're going up a hill. Can you imagine in any way, without, starting the engine, to go up a hill with a car? That is not possible. You have to utilize energy. So that is an example of primary active. But you can work around it in another way by using a secondary active. But still energy somehow utilized by somebody. For example, your car is being taken away by towing. So there's another car in front of you who is using the energy and then tying it to your car and pulling you up. So your car is not using any energy, but somebody else is using. That is an example for secondary active transport. Okay, so this is analogy you can use to remember the differences between them. So when you talk about examples now for primary active transport, there are different types of transporters. One is what is called the P-type transporter. Okay, they're also called E1P. E2 type of transporters. So these transporters, most common example is your sodium, potassium, ATPase. Another example is your hydrogen, potassium, ATPase, which is also called the proton pump in your GIT. Then we have something else called SERCA, sarcoplasmic endoplasmic reticulum, calcium ATPase. These are examples of P-type. Another example is your F-type. This is F4, F1, what you see in oxidative phosphorylation in your mitochondria actually. So here the ulta happens where ATP is synthesized actually. And then another type is V-type, which is usually there in lysosomes, even in your bones for that matter, towards the end. So we'll come across that in various topics in physiology. So anyway, acidification is required. H plus ATPase. But please note that here there's no, unlike this, a potassium is involved here. That is not there, just a H plus ATPase. These are different examples for primary active transport. Out of that, this is the most important one, which can separately come as short notes for you. Okay, so under this short note, what are the things that you have to cover? What is the structure of this? What is the mechanism of its activity? What is the function of this? And what are the factors that are regulating it? So under these headings, I want you to write the short note. So sodium, potassium, ATPase, what is the structure? It has a alpha and a beta domain. Two domains are there. Okay, so you take a look at your membrane, draw a membrane. You place one thing like this, which again has another thing like that over there, and like this. You can draw something like this. This is basically your alpha domain. Okay, it's an alpha subunit of that. Another beta subunit close to it, we can draw over here. This is going to be a beta subunit. Now, this beta subunit usually has some carbohydrate moieties on it. Okay. Now, this over here is where your sodium comes and binds. This is a sodium binding site. How many sodium? 3 sodium. And here is where potassium comes and binds. So this is the potassium binding. How many? 2. Now inside there is also an area which is for ATPase function. So ATPase, what does it do? It converts your ATP and splits it into ADP and inorganic phosphate. Now this inorganic phosphate goes to a particular area which has a aspartate 376 of the amino acid chain. Okay, once it combines to that, structural changes happen to this. Also, there is a particular area extracellularly over here where something called bean can usually bind and inhibit this, which is seen. Okay, and in things like hypertension and all, it's seen to play a role. Extra of these receptors are seen actually. So anyway, you start off with the structure. Alpha, beta subunits, sodium binding, potassium binding, ATPase where inorganic phosphate is binding, and your bean binding site. Now, what is the mechanism? The mechanism is simple. You can write this in 2 different versions, the simple or the difficult one. So what happens is, on one side, your sodium is there, it binds to it. On the other side, potassium is there, ATPase is acting, and once inorganic phosphate is binding to it, this results in a configurational change, and it goes to the opposite side and it goes out. You can do this in a simple way like that. If you want more mocks to be more accurate, you can talk about it in this fashion. So this is existing in a E1 format initially. Okay, remember what these receptors are called, the P-type channels are called. It is also called E1, E2, not channels, pumps actually. E1, E2. Okay, so it accesses in an E1 stage first. In the E1 stage, it is already attached with the ATP. Okay, this is when your sodium will come and bind to it. Sodium has bound to it. Okay, now what is going to happen? Your E1 will become E1P. How will it become E1P? By ATP hydrolysis. Okay, so by ATP hydrolysis, it becomes E1P. And at this point, this E1P will switch to form your E2P. And this is where your sodium is gonna go out. So E1 change to E2. Okay, your E1 change to an E2 shape, because of which sodium can now go out. And at the same time, now what is going to happen? Your phosphate is going to go out, and E2, it will become your E2 stage. And that is when your potassium is going to come into this. Once potassium binds to it, now again what will happen? An ATP will bind to it. And ATP binding to it makes it go back to your E1. So it's very simple. From E1, it becomes E1P, and then it becomes E2P. From E2P, it becomes E2 and goes back to E1. You just have to understand what happens in different phases. In E1, what is happening? Sodium is coming in. Then ATP hydrolysis happens. Then your sodium goes out and your potassium comes in E2 phase. E2 becomes E1 in with the addition of ATP. So this is different way by which your sodium potassium ATPase is actually acting. Okay, so mechanism is also done. What is the function of sodium potassium ATPase in the body? So the thing is, sodium potassium ATPase, it is very important for maintenance of your membrane functions. Okay, for example, your RMP. So there's a term that you're going to come across called electrogenic pump. Why is it electrogenic? Because in the ratio of 3:2, 3 sodium is going out, 2 sodium potassium is coming in. So there's a defect of one positively charged ion, which will help maintain your inside of the membrane negative. Thus, your RMP is maintained in a way. So RMP maintenance is with the help of sodium potassium ATPase. Okay. Another thing is it helps to maintain the volume of cell. How does it help in maintaining volume? So again, the same thing actually, electrogenic. What is happening? Sodium is going out. Sodium is one of the main osmolar constituent of a body. Whereas sodium is going, that is where water is going to go. So imagine a lot of solutes are staying inside the cell. Sodium is there, and that will eventually lead to water coming inside, filling up the cell. It will eventually go big, and burst. And to prevent that, sodium is being taken outside every time, because the sodium potassium ATP is very important to maintain volume and prevent the bursting of cell. So it kind of counteracts your Dornan effect, in fact. Okay, so it is electrogenic in nature, maintains volume, and it is one of the most important things with regard to how much energy utilized in the body. For example, in a cell, around 24% of the energy utilization is sodium potassium ATPase. On the other hand, in a neuron, this will go up to as high as 70%. So this is something that is important for your basal metabolic rate. People with higher mitochondria, higher sodium potassium ATPase activity for any reason will have a higher basal metabolic rate. Okay, and something else we've been talking about earlier. It helps create a gradient for secondary active transport. We'll come across it as we discuss secondary active transport. Okay, so remember that lorry driver who's towing your car away? That is basically a sodium potassium ATPase. Okay, so these are the various functions of sodium potassium ATPase. So function is also done. Now we'll go to regulation. So what increases the activity, what decreases the activity? So thyroid hormone, you have to understand, is something that increases your basal metabolic rate. One of the things it does is increases your sodium potassium ATPase activity. Thyroid hormone increases activity of this. Insulin, aldosterone also increases the activity. On the other hand, if you take a look at things that decrease its activity, dopamine, digitalis, then hypoxia, different forms of hypothermia, and some metabolic poison. 2,4-dinitro. So you can just write these things. Okay, more of this when we talk about endocrine and your respiratory system and all that, you will start understanding this a little better. So this is all the things that you have to write if a short note of sodium potassium ATPase is being asked. Okay. Now we'll come to secondary active transport. So secondary active, you can divide it into two types. So I'll just show you an example and then try to explain it to you. In one scenario, we just put a sodium potassium ATPase here. What does sodium potassium ATPase do? It brings out sodium, puts in potassium. What does it essentially do? Sodium inside the cell is gonna be less. This is very important in what it does. Okay, the same thing I'm gonna repeat it down also. Another sodium potassium ATP, sodium is going out, potassium is coming in, which will make sodium inside lesser. Now I'll just open up a channel here, which is for sodium transportation. Okay, so sodium outside became higher. Usually, sodium is high outside. Okay, now the inside became lower now. Okay, now because of that, it's going to go down the concentration gradient, nothing much done here. But energy was utilized here. Okay, but then you would argue, okay, this is just a, passive kind of a transport. It's only indirectly doing this. So this is where you have to understand. I'll take an example of glucose. Okay, so glucose is higher inside than outside. So when sodium is going in, along with that, somebody else is gonna be carried along with it against the concentration gradient. Okay, so this type of transport is which is called secondary active transport. This is against the concentration gradient. This is a coupled transport. Okay, this is what is called a symport. Okay, symport is happening or co-transport. You can call it co-transport or symport. Another type is where again the sodium is coming in. Sodium will come from a high concentration to a low concentration. Now, instead, if you look at a calcium in the body, calcium is much higher outside. Calcium is usually kept low inside unless, certain conditions needs to be maintained. So one positively charged particle is going in, on the other direction, another positively ion is going. So it went in the opposite direction, and again it is going against the concentration gradient. Who gave the energy for this? That is your sodium. Okay, the sodium potassium ATP is earlier. So this is against the concentration gradient. Okay, so this can be called a counter transporter, or it can be called a antiporter, or some form of exchanger. So different names that you'll come across. So secondary active transport, I hope you're understanding what it is. It is utilizing the energy of something else to create a gradient for it to either go down the same direction or in the opposite direction. But it's always going to be against the concentration gradient. Okay, so that is secondary active transport. Now, coming to the examples of sodium glucose, which is called SGLT transporters. So earlier we saw some glucose transporters, that is GLUT, through facilitated diffusion. This is another example where it is going through a secondary active transporter. In a similar fashion, sodium with amino acid. Okay, sodium with iodide. Apart from all of this, you can have a very good example of sodium, potassium, 2 chloride, which is going to come in your renal system. Okay, another sodium chloride, another sodium bicarbonate. So different types of co-transporters are there. This is all driven by sodium potassium ATPs. I'll just give an example of a divalent metal ion transporter, which will come in your hematology when you're talking about iron in RBC and all that. So this transporter uh, is one example of a hydrogen driven, H plus driven, not Na plus driven. Okay, I'm giving you a lot of examples, and you will most likely, whatever textbooks you're referring to or whatever classes you're going to get, nobody's going to give you so much of information. Okay, then we have your antiporter. So one example is this thing that you just saw, which is called sodium calcium exchanger. Okay, so one is sodium calcium exchanger. Another one is sodium hydrogen exchanger, which is called a housekeeper. Okay, this is also something we'll come across in GIT and all. Okay, then we also have exchangers which are bicarbonate anion exchangers, which can be either, there are types which are sodium dependent, there are types which are sodium independent also. Okay, I'm just giving you examples for, apart from this, there are more examples actually, like Pendrin, OATP, which is important in liver and all. Okay, so these are all examples for secondary active transport. So we got a lot of points. Okay, I've been keeping on talking for almost an hour, trying to give you enough data to write for 10 marks. Usually students stop over here. Okay, if a question of transport across membrane comes, students write only till here and usually stop. That is where they lose marks. Instead of, getting 10 marks, you'll probably get 7 marks. And if somebody is, lenient enough, you might get 8, but you'll never get full marks. That is where you have to talk about how transport of larger particles happen. Okay, so across the membrane, larger particles either exocytosis is happening or endocytosis is happening. When you talk about exocytosis, it can be either a constitutive pathway or a regulated pathway. When you talk about endocytosis, different ways by which endocytosis can happen. It depends on the size of the object actually. You can have phagocytosis. You can have spinocytosis. The spinocytosis can be further divided into micro and macro spinocytosis. Okay. So substances which are more than 0.5 micrometer usually undergo phagocytosis.
Hello, sir.
I'm sorry?
Yeah, sir. Can you wrap up the session now? Team need to work on some technical piece.
Technical issue?
Yeah.
Okay.
Actually, we need 15-minute gap for both classes. So can you wrap up the session now, sir?
Yeah, sure.
Thank you, sir. Sorry for your inconvenience.
Okay. Yeah.